event. Hi, everyone. So just waiting for Dr. Hansen to join us. So today's conversation event is everything you wanted to know about medication that your doctor may prescribe. So we're just waiting for Dr. Hansen to join us. So we see that Dr. Hansen is there, but we've just sent her another invitation. Leanne, if you're listening, if you could just please text Dr. Hansen, letting her know that I have invited her. That's great. Well, today I have the wonderful opportunity of talking to you via my car. I'm actually on my way to San Francisco to the Commonwealth Club to listen to our wonderful founder, Dr. Sophia Yan, talk about all things hormonal care. So we'll give you a little bit more information about that. I'm going to go ahead and attempt to invite Dr. Hansen again. Here we go. We sent her the invitation one more time. And we'll see how things are going there. So, hey everyone. Hi, Hillary. Let's see, my Dr. Donna. Hello, my Dr. Donna. And Divine Soul 2023. Hello there. All right, we have quite a few people. Oh, Dr. Hansen joined. Yay. So, let's see. Now I will invite Dr. Hansen again and see how that goes. So, hi, Dr. Hansen. Can you hear me? Hello. I know. It's so good to see Dr. Adana. Let's see. It says that Dr. Catherine Hansen's unable to join. Why isn't she able to join? I'm not really sure. Oh, there we are. Hello.
Hello.
Well, see, we're trying a new platform today. Dr. Hansen, how are you?
Doing well, thanks. I think you're in your car.
I'm in my car because I have the great honor of going to see Dr. Sophia Yan present at the Commonwealth Club about all things hormonal care, which, as you know, at Pandia Health, we're all about that. You know, not only do we care about your hormones, but we're founded by a doctor, led by women. And we, our mission and our vision is to provide the best care, as possible. Hence, you as the leader of menopause for Pandia Health.
Absolutely. I wish I could take you to see Dr. Sophia Yan. Next time I'll fly down to California, but right now I'm in Houston.
Yeah. Well, you're in Houston, making your travels for your astronaut husband. So, we understand. So, I mentioned before, Pandia Health, we specialize in telemed services, as you know, and we're building a strong economy and a company that provides an excellent ecosystem for both telehealth and your pharmaceutical needs, for example, medication for menopause. And so for today, just wanted to let you know that right now Pandia Health offers services for birth control and acne, and soon menopause. And so today we've started this series called The Conversation Cafe, which at times we will inform patients about, or viewers about, certain things about menopause. Other times we'll take questions, like last week we took questions from viewers. And then today we're informing again about the types of medication that one may be prescribed for menopause, and the benefits and why your doctor may recommend that, and the questions that you should ask. So as an intro to that, first of all, I'd like to give you some time, Dr. Hansen, to tell us a little bit about yourself, and then we'll go into the questions.
Awesome. This is super exciting, and I love that we're trying a new platform. So I'm Dr. Catherine Hansen, board certified OBGYN, and living and working here in Houston, Texas, but really to be part of the menopause expansion. And my passion, near and dear to my heart, is obviously healthcare for women of all ages and stages of life, and also ensuring women have what they need to live their most vibrant, happiest, most thriving part of their life. And of course, midlife throws a few things at us in the menopause arena. Being able to manage that gracefully and to get on with living happy, healthy life is what I'm all about. So I'm excited Pandy is helping women do that.
Yeah, me too. Okay, so an easy in here. What are the most common menopause side effects that we hear about?
Yeah, so symptoms of menopause: hot flashes, night sweats, insomnia, and then all of those vaginal and bladder changes. And some of the cognitive changes too. So brain fog, an increase in anxiety, which we often don't know is menopause related, but we start to feel a little more anxious, a little more stressed. And sometimes we can't remember where the car keys are.
Joint pain as well, Dr. Hansen?
Oh, aches and pains are often very much related. So estrogen or estradiol in our body is an anti-inflammatory. And so as it starts to decline, we can get sort of aches and pains and joint and even some inflammation in other areas that we don't necessarily attribute to menopause, but can be related for sure.
Ah, I see. Well, that's good to know. So talking about estradiol, vaginal cream, how can it help and why would a doctor prescribe that?
Yeah, so I think this evening we're going to talk about estradiol coming in all different forms. So it comes in a vaginal cream, as you just said, and we can also get estrogen in a vaginal ring. But the estrogen vaginal cream is a really nice way to topically apply estrogen in the vagina, impact the vulvar tissues, the vaginal tissues, even some of the bladder implications. So bladder symptoms can be improved through vaginal estrogen as well. And the vaginal ring can kind of go in there and sit in there for 3 months. That's also a really good way to apply topical vaginal estrogen or local vaginal estrogen. And just to remind people that that doesn't really get systemically absorbed. So it's really, really safe for people to use vaginal estrogen in those formats. And I also like to throw in here that there is an oral medication that targets the vagina, selective estrogen receptor modulator, ospemifene, because we want to know that there's all kinds of options. We don't have to put something in the vagina, but often it works really well.
Oh, okay. Okay. So oral for those of us that are a little shy, I suppose.
Yeah, exactly. and it happens, people don't necessarily want to put stuff in there or put stuff down there, or they can't reach, or they're not mobile.
That's true. That's true.
Sometimes issues around getting stuff in the vagina. And so, yeah, there's other ways, but vaginal estrogen is really good for treating those vaginal symptoms.
Mm-hmm. Now, you said something earlier about oh gosh, you said something about the cream, that there's different methods. Yeah, there's times when you want to do the cream and others not. Is there a reason why, other than having difficulties, with movement and not being able to reach down there?
Well, what I hear in the office is that women sometimes don't remember to put the cream in, because it's every night for 2 weeks to start, and then twice a week to keep up with that maintenance it going. And so sometimes women will forget, and so compliance becomes a real big issue. And if you're not using it, you're not getting success, or you're not getting treatment from it. So then you're not getting rid of those symptoms. So that's one of the reasons people wouldn't want to put something in their vagina. Other than that, it's spontaneity. You go and put a big applicator full of estrogen in your vagina, and then you want to have sex. Well, what's going to happen? It's going to come blopping out. So it sometimes takes away the spontaneity, but it's not all bad. There's lots of great things about it.
Okay. And that's so that's what I was trying to ask, and I'm looking at my notes here. You said transdermal or oral. So can you explain the difference as to why, aside from physical limitations, why one would go with one over the other, or why the doctor would recommend one or the other?
Yeah, so great. So just to clarify, we were talking about vaginal estrogen or vaginal estradiol, and that's for local symptoms as well as some other treatments we just mentioned. But if a woman needs hot flashes or night sweats or some of those cognitive symptoms or the aches and pains treated, it really needs to be a systemic treatment. So all through the body. And that's where we go with a transdermal, which is like a patch or a cream applied on the skin. so transdermal, or an oral, which is basically put in the mouth. And so those are systemic or menopausal hormone therapy, as women are more used to hearing about. And to differentiate, we can go either way. Oral can sometimes be more convenient, especially if it's hot and humid in Houston and your patch is falling off.
Mhm.
But dermal is really good because it actually doesn't go through first pass metabolism at the liver, and so there's not as many coagulation or clotting risks. And so we know that transdermal is a little bit safer when it comes to talking about some of the really severe side effects like stroke or blood clots. The patch or the cream or the transdermal forms are potentially a little safer than oral. So that's usually what we start with, is a
Okay.
patch.
Okay, great. Well, thank you for that. I did get that a little mixed up, but that's why we're here. We're here to learn, right? Because all these different medications are coming all over the place. That you want to be a very good advocate for yourself by asking those questions, and the doctor to, give you this information so that you know what you're taking, and, taking control over your hormones instead of your hormones taking control over you.
Yeah,
Uh,
absolutely, Donna. And just to be really clear, so many women have these questions and are confused about this. Up to 75% of women don't know what to do, and they're really not sure how to proceed. So these kinds of conversations and all of the questions that come are really important.
mhm. Thank you. So, is there anything else that I may have missed in regards to, like, the cream, the vaginal cream, or oral, or transdermal, that I should note?
Yeah, I always like to, and I like to bring this back in. I have specialty training in sexual health, and I like to bring this back in that women sometimes come in the office and they think sex has an expiry date. It does not. And
Oh.
we want to make sure that people know that there are ways to get all of those tissues, vulvar, vaginal, all of the sexual organs kind of fired up again. And menopausal hormone therapy is one of those ways, whether it's transdermal, whether it's oral, whether it's a vaginal application, maybe a combination. Talking to your doctor and making sure that sex stays satisfying is really important.
So there's two. Thank you for that. There's two things about that, because that keeps on coming up a lot, right? One of them is the dryness, right? It can be painful, but the other one is low libido. Now, will these medications help us with both?
Sometimes, I mean, they definitely help with dryness as well as personal lubrication or lubricants. Sometimes they'll help with libido. And so what's really interesting about sexual desire is it's so enmeshed in so many other factors. So there's the physical, as we're talking about, the dryness, irritation, also decreased arousal and decreased sensation
Mhm.
in the vulvar tissues, because the blood supply, when the estrogen goes down and the vascular changes, the blood supply is not as great. Menopausal hormone therapy will help with all of those things. And when we help with all of those things, we sometimes have
Mhm.
improvement in desire, because if
Mhm.
we like it and it feels good, there's arousal, reach orgasm, we want to do it again. And so that is really important. It doesn't have a direct impact on libido, but we do see improvement in sexual
Mhm.
desire when we know that those tissues and the estradiol or menopausal hormone therapy is working well.
Okay. Okay. Great. Thank you for the clarification. Now, the other question that we wanted to cover that I see here is asking the difference between another popular medication is PremPro. What is this medication and how does it work?
Yeah. So when we talk about women who have a uterus, and we always have to bring this up, and we mention this a lot at Pandia, when women have a uterus, they can't just take estradiol. They have to take progesterone or a form of progestin with it to protect the lining of the uterus and make sure there's no precancer or cancer that develops. There's some added benefits to some types of progesterone, which I'll mention in a second, but ultimately it's to protect the uterus from cancer. We cannot take estrogen alone. And so when a woman takes her estradiol, it can be a patch, it can be a cream, but then she also needs to add to it that progesterone or progestin. There's a couple of ways to do that. What you mentioned is PremPro, HRT. There's different versions of estrogen and progesterone that are put together in an oral pack. It is kind of similar to a birth control pack, and so women find it really convenient, and it's oral. So if you want to
Mm.
take something oral, they certainly can. In a patch, progesterone can be put together in the patch. That would be like Climera Pro, for example. And it can be an estrogen and progesterone together in a patch, which therefore both can be taken together. Now, you can take a pill with both together, PremPro or HRT or those kinds of versions. You can take the patch with both together. What we normally hear from women is they like to go with something bioidentical or body identical. And the FDA approved versions of that would be an estradiol patch with an oral progesterone. So micronized progesterone, and it has to be oral, and we usually take that at night. So when I mentioned those other positive things about progesterone, that medication taken at night can sometimes be calming, can sometimes have some additional benefits. And so why do we do that? It's not as convenient as together in a pill or together in a patch, but who want the bioidentical or body identical version, they need to do a patch for their estradiol because that's a bioidentical estrogen, and a pill for their progesterone because that's a bioidentical progesterone.
Okay, great. What is bioidentical?
Bioidentical means that the compound itself fits into the human receptor. Ultimately, that's what it means.
Wouldn't that be for everything, or?
Yeah, so interestingly, the estrogen and the progesterone that are in something like PremPro or some of these other versions that are not considered bioidentical, body identical, are more synthetic. In other words, it's a conjugated equine estrogen in the PremPro, or a medroxyprogesterone acetate as the progestin version in the PremPro. PremPro is just one example, HRT, PremPhase, there's others. And so they're more synthetic versions of those estrogen and progesterones. So then people ask, well, why would I do that?
Right.
Convenient.
Yeah, why would you do that?
Yeah, convenient. Convenient. If a woman says to me, I want everything in one patch, it's going to be easier for me than taking a pill at night. We put everything in one patch. And what has to happen is, in the lab, they have to shift that progesterone a little bit for shelf life, for stability. And when they do that, they make it a little more synthetic. It doesn't necessarily mean there's anything wrong with it. It just doesn't fit in that definition of bioidentical or body identical.
Okay.
It could be more convenient. So that's why when we have these big conversations, we want to make sure women are getting what they want, what's personalized to their lifestyle, what's going to fit, what's going to be easy for them to remember, and get them back on track.
Okay. All right. Wow. That was a lot to unpack, because sometimes, as doctors, these so well, and I'm listening to them, I'm thinking, okay, how do I know what's best for me? And I know one of the areas is that what's convenient for me based on what I want in my lifestyle, the doctor may recommend one thing over the other. We know that they're both safe.
Exactly.
It's just, it's just that some have a longer shelf life, and I only have to worry about one type of medication, whereas with others, I may have to do multiple.
Exactly. And last time we had this conversation, we talked about, there's that time frame when it's safe. It's safe when you're within 10 years of menopause. It's safe under the age of 60. It can be safe beyond that. So that's worth a really important conversation for women who are over 60 or more than 10 years from menopause, but definitely safe for most people, the vast majority of women, and also very safe in specific timings.
Great. Okay. So those are the questions I had. So about medication, are there any types of medications that I've neglected to ask you about that you really think we should talk about?
Yeah, so this evening, I think we covered, I'll just sum up, we covered vaginal estradiol in the form of a cream. We covered estrogen for the vagina in the form of a ring. We covered an oral medication, ospemifene, which targets the vagina, but it's taken orally. That's a really kind of a magic sort of thing. Works really interestingly in the body. We talked about estradiol that you can take in the form of a pill or in a patch, and we talked about combinations of estrogen and progesterone in a pill, estrogen and progesterone in a patch, and finally that pill that is the one form of bioidentical progesterone that we can take, which is in a little round capsule that you take at night to protect your uterus. I think we covered all of the hormonal versions that we wanted to be talking about this evening, Susanna. And I know we'll come back and talk about non-hormone options and complementary more natural options, even though estradiol and micronized progesterone are natural bioidentical, there are others that we will want to cover as well.
Great, great. Thank you. So as always, we always talk about it's not just medication, but it's a lifestyle um, upgrade that we want to do about taking care of ourselves, reducing, the intake of alcohol, especially caffeine and alcohol if we're having hot flashes, right? For joint pain, more walking and things like that.
Oh, yeah. You know me well, Susanna. I harp on that a lot. So I always explain to patients it's tiered, right? We start foundationally with lifestyle, and lifestyle is physical, so diet, nutrition, exercise, sleep, stress management. All of those things can't be underestimated. And then we build on top of that some of the more natural approaches. You can add in some omega-3s or fish oils if you're not getting fish in your diet. Vitamin D is really important for calcium. We want to make sure that women are getting the nutrients that they need, and that can be piled on sort of that next layer. And then prescriptions would come after that in the form of hormones, which we talked about, or non-hormones, which we can talk about another time.
Okay, great. So Leanna has a question. She's like, can hot flashes be managed with good exercise?
Ooh, great question. So exercise by itself is not thought to help with hot flashes directly, but exercise being really regular, as you alluded to, helps get the joints moving, bones, muscles moving, can help with some of that achiness that we get in the morning. But regular exercise, and I tell patients they need to be moving their body every single day, even if they don't feel like they have time. That helps with weight management. And weight management reduces hot flashes, night sweats, and other vasomotor symptoms. So not directly, but exercise helps in many other ways.
Okay, got it. So because most women, when you talk to them about menopause, like I would say myself as an example, we all talk about hot flashes. Like that's like the one that everyone can relate to. Like, yes, that freaking nightmare, right? Um, so so it really is. So then when you go and talk to your doctor about that, they're going to prescribe some type of medication, right? And
Well,
and that. Mhm.
Yes, but we do find success when we go really clean diet, really regular exercise, restorative sleep. Sometimes hot flashes are worse if we're not sleeping or we're overly stressed. And so that foundational layer that you just reminded me is really important, is really, really important. And then if that doesn't work after a really good conversation with your doctor, then likely a hormone or a prescription of some kind is going to be prescribed. And on that note, just to be sure, we don't want to be waiting to get really good menopausal hormone therapy treatment if it's appropriate for us, because we want to prevent any degradation or any loss of some of the benefits with respect to bones, heart, brain, skin, elasticity, other organs. If we leave that estrogen decline for too long and we don't start the menopausal hormone therapy at the right time and the right dose, then we don't reap those preventative benefits.
Okay, so we want to, work on a good, healthy lifestyle, upgrading it to make sure that we reduce those hot flashes. But you're also saying consider starting your hormone therapy to prevent like a steep decline of elasticity and bone density. Is that right?
That's right. Yeah, menopausal hormone therapy will, by bringing the estrogen or maintaining the estrogen from that steep decline, it will protect the bones. Absolutely. It's preventative for bone health, and it's on most midlife women. Hormone therapy is started at the right time.
So it's not just, hey, let's wait till we have side effects. It is take control over your body and your hormones so that you don't have this crazy decline. Protect, every stage of your life. Start your hormonal therapy as soon as possible.
Absolutely.
Okay. Because I was thinking like what I heard first was like, wait, before you start hormonal therapy and you hot flashes, go ahead, obviously work on your lifestyle, upgrade your lifestyle, get the exercise, eat well, multicolored in your plate and everything, and then talk to your doctor. But we're also saying at the same time, invest in yourself, check out your health with a hormonal expert, and start getting the medication you need to protect your body for the long term.
Bada boom, you got it.
I did it. I finally did it. All right. Well, I think we've, picked up quite a few tidbits here. I know that we have another live event on the 7th of December, and we'll be asking our viewers to submit their questions, and then we will go ahead and answer those questions then, and then perhaps talk about non-hormonal medications as well. What do you think about that, Dr. Hansen?
That sounds great. So no question is off the table. Send them in and see if you can shock and awe me, because I've been doing this for over 25 years, and in the women's space and in the sexual health space and in the menopausal space, all ages and stages, you cannot send me a question that I would not love to answer. So bring it on.
Yeah. Well, thank you. Yeah, I think we have to go back again, because I did get some comments back from last time talking about, you made a comment about those urinary problems, and how that like got people all riled up. Like, when do we start taking care of that? What happens if you're in that stage right now? One person sent me a link to a TikTok video where there's a wand or something that tightens up your your muscles so that your urinary tract isn't as loose. So I don't know anything about that, but these are things that are very heavy on people's minds, because all of a sudden you're having all these accidents at times, and how do you resolve that, and how do you prevent that?
Yeah.
So next time we'll talk about that. All right. Well, listen, thank you so much for your time. I appreciate it. And thank you to everyone for joining us, and have a wonderful night. And don't forget that Pandia Health. Well, why don't you close with that, Dr. Hansen, since you're the lead of Menopause?
Absolutely. So Pandia Health has an online platform, convenient, compassionate, exceptionally credible care provided by doctors led by myself and Dr. Stephanie Culver, both Menopause Society certified practitioners. And come on over to pandiahealth.com, where you'll find Menopause. Sign up to be on our VIP list, and there will be discounts and all kinds of things sent to you. So make sure you get on that list. We are really excited to be launching this menopause branch, because we know how desperately it is needed for midlife women to wake up in midlife and really be living their healthiest, happiest, most thriving version of themselves. So thanks. It's been fun doing this with you. Let's do it again.
Yes, let's do it. Great. Thank you. Bye.
Have a good night, everybody.
Good night.